liver cirrhosis, cancer. So we understood that it is very important for us to discuss this. And please remember, 70% of adults addicted to substances start in teenage only. It doesn't mean that patient comes to us and tell, I am taking a substance and then I need your counseling. Many times they come to you for some other medical problem. I'm just going to quote a simple example. My regular patient, 15 years old boy, came after a long time. He was asthmatic, so he was my regular patient. He came with the passing of high colored urine. Father has done all investigation, liver function does, shows a viral hepatitis. But he was very fidgety and very restless. When I was examining, I could see the injection marks or track marks. So he, after the heads and all those things, he accepted that he was taking drugs from last 1 year because there was a familial dysfunction because parents wanted to divorce. So let us other pediatric examination also, and everybody is susceptible to that. It is a universal, no racial preponderance or ethnic or gender, any gender specificity. As we know that general population, everybody is prone for that, but the incidence of drug abuse is common in the teenagers. All of we know about the neurodevelopment. I'm not going to dwell into the detail. In the neurochemical changes, we know that highly reactive limbic system and reward center with immature prefrontal cortex makes them vulnerable to the drugs. And there is a uh, increased activity of the neuronal circuits which utilize dopamine. There is a creating drive for reward. So neurodevelopment, neurochemical changes, and stress response is little more exaggerated. So we understood that peer pressure, desire to experiment, curious thing, lack of life skills, changing lifestyle and family structure. Parents are permissive or sometimes neglectful. Parents take alcohol with the children. It is a new trend. Influence of media and lack of media literacy because celebrities are giving, participating in this advertisement. Easy availability of drugs, which is very important. And many times there is a low self-esteem because of various reasons. They may be having anxiety, depression, or some other comorbid condition. But let us not forget there is a genetical proneness is also there. All these things are required to remember when we are doing a counseling or we are working up on these children. So this is a short thing that why adolescents are also susceptible. And one more thing, the addiction of drugs progress very fast from casual use to dependence. It might have been started as experimental, it may be recreational, it may be a social norm, but they can use a multiple substances, and there is a higher risk that presenting with psychiatric comorbidities already I mentioned. And we know that prevalence of substance abuse is substantially increasing. It has become a public health issue. So great awareness and education for prevention and treatment is required. All of we know that most of the drug act as a neurotoxins which cause damage to the brain. It hijacks the reward center. It impairs the functioning of the prefrontal cortex. It reduces the size of hippocampus, results in poor memory and impairment of judgment. There may be epigenetic effect also. Resistance to aversive effects is, see, many times if you take some drug, we get a headache, vomiting, bloating, but they become resistant to that. They want to enjoy the relaxation what it gives. So please remember, this is a basic which I am talking. And always there was a movie Udta Punjab. So many people feel that drugs are more epidemic in Punjab. No, this is a our government survey which shows that it is there in Delhi, Mumbai, Mizoram, Manipur, Goa, and every state has got a different problem. From our state, there is a Niman study is there. They show that alcohol is almost 85 to 89%. So cannabis is there in Uttaranchal and Haryana. Same way we have to know the what are the substance used in our country. So tobacco is the commonest in various forms, alcohol, cannabis. Cannabis, many times it is a licit, bhang, and that a product is also easily available. Inhalants, poor people use this because so many substances are very expensive. There is nobody spared, no socioeconomic status. Everybody is prone for that. Hallucinogens, sedatives, opiates, injectable substances. So what are these poor persons doing? Petrol, liquid glue, paint thinner, whitener. I think ink, I think that is not available, but other things are there. Now, let me tell about the stages of substance abuse without going into detail. Initially, they start as experimentation with their friends, and that time they can stop it if they decide to stop and with their own motivation. But if they feel it is very comfortable, they go for a regular use in a predictable way on the weekends with the friends. Later on leads to risky use and becomes a dependency. And this addiction may lead them to steal, sell the things to relieve the agony and fulfill the cravings. And we need to concentrate when we are counseling about the vulnerable population. So it is all things, all of you know that illiterate teens, school dropouts, unemployed, street children, family problems, abused adolescent with a mental disorders, chronic diseases, conduct disorders. They say males it is common, but of late study shows that it is common in both. So mean age of onset is in early adolescence. So we have to act very fast because initiation is very early. We need not have to wait till late adolescent or young adults. See, tobacco, 12.3, alcohol, cannabis, all. So now we understood these things. Now let us know when we are doing a counseling, we need to know the risk factors on the individual level. Already we saw that who is the vulnerable for that. And very important thing, the adolescents who are vulnerable, they are very impulsive, sensation seeking, and they have got a low self-esteem. They may be themselves may be a victim of the violence and sexual abuse. So school, they may be poor school connectedness, school failure, adjustment problem, drug abuse by the teachers, peer abuse, peer pressure is very, very common, delinquent and violent group, family dysfunction, violence in the family history of drug use, and very important thing I want to highlight, community also. Easy accessibility of the drugs. Many times these drugs are sold in the vicinity of good schools because there is a poor law enforcement. Poverty and illiteracy leads them, unemployment leads them to take it, consume it, as well as sell it. So disorganized and violent neighborhood. But we have got something in our hand. We can protect them if they have got high aspirations. It is a very protective factor, resilience, involvement in spiritual activity, which is a very important point, family school connectedness, preventive factors, risk factors to reduce, preventive factors to increase. Hard work, self motivation, persistence, good morals, self control, and confidence, having a good life skill to say no, parental support, help by the friends and teachers. So we understood about certain basics, but we need to be proactively see what are the red flag signs of substance abuse. Not only we have to learn, but we have to make parents, teachers, community to be aware. Many times we see that they try to use a perfume to mask the smell. They do not like to hug the parent. They don't like to come. They lock themselves in the rooms and they don't sometimes they spend a lot of time in the toilet, sleep disturbance, eating style disturbance, school performance deteriorates. They have got a new set of the friends, loss of interest in activities which they enjoyed before, various vague symptoms. Sometimes there is a regression and there are track marks, cutaneous manifestations are there. There's just red eyes, stained teeth, track marks, drowsiness. When they come to us for anything medical problem or for certificate for vaccination, it is our genuine duty to proactively look into this. Many times they like to get entertained with a high action and drug abuse. They like a horror movies, violent movies. They are very irritable, sometimes very anxious, having tremors. They start fighting with the parents and teachers, and many times stealing is common to buy the drugs. And this is a medical aspect. What are the indicators? So indicators, drug specific indicators, we can't go into detail. This is a total medical things. A simple thing, marijuana or cannabis. You see red conjunctiva, abnormal pupil, gynecomastia, small testes, irregular periods, increased appetite for sweets. So this thing I'm just highlighting that we should know about this. We are read Hutchison. This also has to be included there now. So there is a classification based on effects on the CNS. The other classification, which you saw here, individual one, this is whether they are depressant, hallucinogen, stimulant, or like a photoin, morphine, pethidine. You know that stimulant is methylphenidate or cocaine. Hallucinogen is LSD. So depressant are alcohol, tranquilizers. So this is the chart where we can find out what is the action on the nervous system, what are the example, how are they acute effect, what are the withdrawal symptoms and relapse. It is out of purview of this discussion. I will share this in the group. Withdrawal symptom, sudden stopping or decreasing the drug. But we can successfully treat with medically supervised detox and rehabilitation center. See, we know that comorbidities like depression increase the 10% chances of suicide. But if there is a substance abuse, it is a 25% chance of suicide. Now I'm seeing the individual things, but I'm not going to highlight everything. This is India's global youth tobacco survey, in which they say that important thing 14.6 students use some form of tobacco and 4% smoke cigarettes. So it is a very alarming thing for us. Nicotine is the addictive chemical. We know it is a more common substance abuse in India. Teen smoking increases if parents are smoking, and it is easily available. See, madam is going to highlight about these things, so I'm not going to go into details of e-cigarettes and hookahs. They look very stylish, cool, they are fashionable, but they're addictive. So we should know that use of e-cigarettes, apart from the tobacco cigarette routinely used, it has increased from zero point 0.6 in 2011 to 4.9 in 2018. It may not contain tobacco, but it contains equally toxic things. Simple example is that cannabinoids are there. Then tetrahydrocannabinol is there, which are definitely not healthy ones. Neither they are responsible for stopping the smoking. E-cigarettes, what we call, it is heats the liquid chemicals into a vapor and they start inhaling it. That is a vapes, vape pens, modes, tanks. And in future, we are going to, when you ask the symptom, dry cough, throat irritation, liquid pneumonia, relate with the e-cigarettes. And there is a second-hand aerosol exposure is going to the future. We say secondary smoking, primary, secondary, tertiary. We have to think about this also. And whatever we have done to control tobacco control will go wasted. E-cigarettes as such, legally they are banned from 2019. Hookah, there is a myth that toxic smoke goes through the water and then it is all filtrated and there is nothing if you inhale it. But in fact, it contains tar, heavy metals, some carcinogenic things, carbon monoxide. So that is not safe. Now let us move on to the alcohol. I'm not covering everything, highlighting which is required for this session. Those who start drinking before age 15 are 5 times more likely to become alcoholic. And the statistic is amazing that 26% of youth have their first drink of alcohol before the age of 13. This is an Indian study, and it is a major cause of motor vehicle accidents and high risk behaviors for premature death, disabilities, and violence. It is acceptable as a social norm. Is it going to uh, just start once and then think that it is not going to progress? Not at all. So adolescents who engage in excessive drinking impacts their life of surrounding people also. Scientifically, maybe we can say that NMDA receptor function may inhibit normal prefrontal cortex function. The minimal legal age in India is 18 to 25 years. That we have to remember. Many people feel that once drinking, nothing happens. It is better. Beer is better than the hard liquor. Alcohol helps to get good sleep, enhances sexual performance, it gives energy. And alcohol drinkers are cool, non-drinkers are boring. So smoking and alcohol are considered as a gateway drug. That is a pet word of Swati Bhave, madam. So once you start this habit, it can lead to use of other drugs also. Maybe because of the biological factor like early exposure alters the brain reward pathways. Psychological factors are there. It lowers the fear of trying the drug, increasing risk taking. Social factors. There is a peer pressure. And you feel that taking drug is normal, easier to access other substance. It is easier after that to access the other substances. So these are certain things that is the thing they are called as gateway drugs. Now, cannabis, marijuana. See, we know that bhang lassi, bhang thanda is legally allowed. Then there are so many things. It is available as a smoking, vaporizing within the food, as it is available in many places as an extract. It is sold on the road some places. It is a mind and mood altering drug, causes distortion, and I already have highlighted. So should we use as a recreational and medicinal use? Not at all, because we don't have proper drug regulation. Around 9% of people who try it ultimately become addicts. So there is a relapse rate is very high. As such, it is cultivation of cannabinoids is banned under the act. So LSD, it causes hallucination. It is highly potent, so absorbed into small pieces of paper. It lasts for 12 hours. So MDMA, this is common in the rave parties, causes euphoria. Body becomes hot when vigorous and prolonged dancing, but it may be detrimental to brain, kidneys, and liver. Amphetamine is used by adolescents to stay awake while studying. It may cause side effects. Cocaine is the thing which causes a, it is like a sniffing powder. It is called as a white angel powder. It is available everywhere. You can see in the picture, and it causes restlessness, but they feel euphoria, high energy, and alertness. Heroin, it is a cause of death from drugs in US. It is a, that also causes euphoria. There are prescription drugs like sleeping pills, cough syrup, painkillers. If we don't address all these things about the drugs, it leads to detrimental consequences. And already I have told, it may lead to homicide, suicide, assault, RTAs, drowning, suicide, rapes, child abuse. So it is a very active role pediatrician has to play with the screening, anticipatory guidance, which Dr. Swati will be covering now. And this is a Niman study. Some of the adolescents don't tell us. When they come to us, they tell, I have stopped it, but you can get a blood test done. Alcohol is there for 72 hours. Like that, we should know benzodiazepines is present for 4 weeks. This breath alcohol meter, everyone knows it is, police people use it. This can be also used. It is used in some of the centers in Nimans to find out how much is the alcohol. It very well correlates with the alcohol in the blood and the breath. There is a correlation. As such, relapse and trigger for relapse will be discussed by Swati. And those who have been in recovery for a lengthy amount of time will lose their tolerance for the drug abuse. Taking the amount they were accustomed to consuming during the height of their abuse could result in overdose and even death. So let us talk to them. It is illegal to possess the drug, use the drug, give the drugs to other person, sell the drug to other person. It can cause arrest. So you have heard Diego Maradona, who was a football player. He became addicted to alcohol and cocaine. He could not cope up with the success what he got it. And his life was hell for the next 25 years till he died in the rehabilitation centers. So we have to talk to the community. We have to work with them. And I think I'm just telling what IIP has done. Recently, there was one documentary made, Disha. I think many of you would have seen that. It is there in the YouTube about the substance abuse. IIP has come with standard treatment guidelines. It is there in our many academic activities. Government has got a Nasha Mukta Bharat, and Nimans had got a academy. There is a virtual knowledge is there. So I like to end here mentioning that as the counseling session is going to start after this, drug abuse is a medico-socio-economic problem. Early and increased use of drugs is observed in the early adolescent. Prevention is more effective than the treatment because relapses are common. Adolescents should be well informed. Caretakers should be informed. Media literacy is essential. Legislation is required to minimize the influence. Multidisciplinary centers are required for management. So everybody we can tell early, every adolescent should be reminded that though it is fun to experiment and thrilling to be part of the team, the colors and ecstasy of floating are all too good to resist. But at the end of all, you are killing yourself inch by inch, day by day. So drug abuse trafficking day is there, 26 June, International Day. So these are more references, and there are most of the references from Dr. Swati Madam's uh, publications. So thank you very much. And now should I, Kiran, invite Dr. Swati Ghate to start with the in the continuity counseling session strategies. So it is very important for next half an hour. We have to be very attentive and At the end, we will take all the questions. And Swati madam will be there with us that time. Kavita, anything need to be done?
No,
Maybe
ma'am.
you can.
We can, yeah, you can continue, ma'am. Yeah, Swati
Okay.
ma'am can continue.
Swati, share your slides.
Thank you so much. A very good afternoon to all. Thank you, Geeta madam, for this wonderful talk. And I thank the organizers for this opportunity. Are you able to see my slides?
Yes, yes, yes. Go ahead. Full
Just a
slide,
minute.
full slide. Full.
Yes, just a minute.
I think it is very carefully, all of you listen, because this is a very important session. We know about the basics of the substance abuse, which is all theoretical, but actually in the clinic, in the OPD, how are you going to manage? This Swati, one of the expert who has worked so much, she will clarify now. Yes, go ahead.
Yes. So, madam has done a lot of work for me, and many of the things are pretty much clear. Am I audible? Hello, madam, am I audible?
Yes, yes, yes. Go
Yes,
ahead.
yes, you are audible.
Very much audible.
Thank you. So we'll go with these points, why we should learn the counseling strategies, how to screen for substance abuse, what is brief intervention, and what are various counseling modalities used in this substance abuse in adolescents. Madam has already told us that it is our important duty to screen as pediatricians, and because this pediatricians, a big study conducted by AAP showed us that excessive alcohol use is also missed by pediatricians because they rely on their clinical impressions. So there is a shift in the approach on adolescent substance abuse, and we are now looking for addiction, not only for addiction, but we are looking for screening of each and every adolescent. Not only those who are high risk, but also we are trying to screen the low risk adolescents, and also then helping them with opportunities of early intervention. This has already been said that these are the getaway drugs because they are legal. And most important part is that they impose a lot of health cost also, more than all the illegal drugs put together. So for screening, these three drugs, alcohol, tobacco, and marijuana, are used. There are various screening tools which are to be used in the OPD basis. One of the most popular is this 5A's model, which was given for tobacco. Ask at every visit, advise to quit, assess readiness to quit, assist with a quit plan, and arrange a referral for a specialist center when required. So this is the crux of all the screening protocols that are being used, and there are many of them. But for us, the recommended screening tool is SBRIT, that is screening, brief intervention, and referral for treatment. This has been recommended by all the international authorities and also by our own Indian Psychiatry Society, and it has appeared as their clinical practice guidelines in their journal. Also, our own AHA Mission Kishore Uday has recommended this, and we are using this since 2018-19. So let us see what is this S2BI tool. So this model, which is, it includes two tools. One tool is called S2BI, which is screening to brief intervention tool, and the other one is a craft. These are the questionnaires, and this model, it emphasizes screening of quickly assessing the severity of the substance abuse and deciding on the level of and modality of treatment, brief intervention for those who are at the mild or moderate risk, and those who are at higher risk, we are then referring them to higher centers. And only 5% of the patients need this type of a higher center. So we can take care of almost 95% of them. And that is the reason why we are discussing this today. This is a very simple tool which has 3 questions in the first part. In the past year, how many times have you used tobacco in any form, alcohol, or marijuana? So if all the 3 answers are never, then the screening stops there. But if the answers are other than never, that is once or twice, monthly or weekly, then we have to ask other questions like if the adolescent has used prescription drugs or any illegal drugs, inhalants, or herbs or synthetic drugs. Along with this questionnaire craft is also used which assesses how the adolescent is consuming the alcohol or any other drug. So these 6 questions he has to answer in yes or no. The first question is, have you ever ridden in a car driven by someone, including yourself, who was high or had been using alcohol or drugs? Second is about whether he has used this for relaxation. Third is whether he has used this when he was alone or only he has used this when he is in company of his friends. Then the fourth question asks whether he forgets things that he did while he was using alcohol. And fifth one is about family or friends asking him to cut down the use. And sixth is about getting into trouble, like quarrels or any legal issues. And every yes is given 1 mark. If the score is more than 2, then he falls into the high risk category and he needs treatment. So with these simple tools, we can ascertain which patient needs to be taken seriously and referred. So this table shows how the risk levels are defined. So one who answers never, he has no substance use and he needs only a positive reinforcement. Once or twice, the users, do not have any SUD risk per se, but they need brief advice because they are also adolescents and they are potential, they could land into substance abuse later. Then those who are using monthly, they have mild to moderate SUD risk. They need brief intervention, motivational intervention to reduce the use and risky behavior. And for those who are using it weekly or more, they are in great risk and then they need referral to treatment. So, so for those who are non-users, positive reinforcement is very, very important for their decision. Also, we have to praise and encourage them and compliment for their other healthy behaviors. This will keep them sticking to their behavior. Anticipatory guidance is very important. So many times what happens is we cannot just bluntly ask such questions as, have you ever smoked? So during our head SS history, we can put it the same questions in some other ways. What do your friends do when you are spending time together? Or some people of your age indulge in consuming substances. What is your opinion regarding their behavior? Sometimes we can put questions like this. Some people around us are smoking or doing drugs, which affects us, our lives, and we like getting cough, feeling irritated, or feeling like trying the drug. Have you ever experienced that? So sometimes such type of questions can make us go to the screening tools that we are using, that we have just discussed. Every adolescent must be told that it is very, very important to know that in no time you can fall from the curiosity and experimental use to an addiction, which madam has already told. So this chart helps us tell them that this path could be very speedily taken. And for that, what we need is adolescent empowerment on various life skills, including assertiveness. We should teach them managing stress and relaxation techniques. Identifying their strengths and weaknesses is very important so that they set realistic goals, because realistic goal setting is very important for a healthy life. And many of our adolescents are like unrealistic in their wishes, and then they fall prey to a lot of stress and result into addiction. And how to say no is one of the very important skills that every adolescent should be taught beforehand in the anticipatory guidance. So it starts from polite refusal to avoid the situation, and it will be covered in the role play. Coming to a case scenario, this is a case of Manisha, who was brought for HPV vaccination. Her parents had no concerns. But during her EDSS history taking, she confessed that she has consumed alcohol during her friend's birthday party 10 days back. She said that she wanted to try it once, did not like the test and had vomiting, but she hasn't revealed it to her parents. And she says that she hasn't ever tried any other drug before or after this. So what is her risk for SUD and what to do next? So she lies here. Even though there is no SUD risk, we have to give her a brief advice. And this brief advice given to experimental users must contain a clear advice to stop. because these adolescents, they want clear, concise, and maybe an uncomfortable advice, but it has to come right directly from the authority, like a medical person. You have to explain all the adverse effects, and also you have to share that you're concerned about their safety and not being just a preachy person. So how can we convince them? It is when we have taken the HEDSS history, we know their strengths and aspirations, and making it a tailored approach and relevant to the particular adolescent is very, very crucial. So those who are in sports or health or beauty conscious could be given the physical health hazards like the lung capacity being less by smoking or the staining of teeth or something like that. Those who are studious and career oriented may be told that memory goes down. Those who are creative, they could be told that the alcohol doesn't, the alcohol decreases motivation. Those who are social and extrovert, maybe relationship issues is important for them. So to avoid relationship issues, they will stay away from the substances of abuse. Then when parents are themselves into alcohol, we have to teach them how to be empathetic for their parents. Maybe you can tell them that they were not lucky enough to get a counseling, and so they are today into that bad habit. Most important thing is to ask them wish list. And with this wish list, we can always combine the monetary losses and make them realize that what wrong they are doing. Always health education through pamphlets, authentic sites, apps, videos, and peer educators make a great difference in adolescent substance abuse. So, Madam has already explained that first experience could be devastating, and the fact that only addiction can lead to side effects or hazards is a myth. So, these are the pictures, something like that we could share with them, that these girls, they were caught during the rave party, someone being sexually assaulted or a vehicular accident. All this could be in the first experience itself. Then this picture of a brain, which is a substance abuser brain, which is not so active as compared to a non-user's brain. Such things are very catchy for them and they understand it better. Also, gang behavior. We have to tell them that juvenile crimes, the heinous crimes, are generally done by gangs and who are under the influence, and law is no more kind to minors also. Drinking and driving is also very important, and we need to teach them that the detrimental effect is on a teenager brain starts at lower blood alcohol content as compared to adults, and could result into reduced hand-eye coordination, blurred vision, decision-making, and reaction time getting impaired. What they think is, if I am able to walk, I shall be able to drive. So we have to give them all this scientific information in a very emphatic way. This again is a myth that above 18 everyone can drink, but it is illegal in many parts of India. Substance abuse and sexual activity is also very close to their heart. If they know that there is a loss of inhibition, unprotected sexual encounter may result and it will have its own consequences. And this flunitrazepam, which is called a date rape drug, it causes amnesia, it is colorless, odorless, and so not to accept drinks in open classes has to be given as an anticipatory guidance. Also, we should tell them that there are long-term effects on sexual and reproductive abilities with the substance abuse. Coming to case scenario 2, it's a case of Mahesh, who is brought for behaving differently since 2 months. He is restless, he complains of vague aches and pains, and doesn't sleep or eat well. He's from an affluent family, which is very educated and disturbed family. Father is a smoker and he has found out that cigarettes were missing. Mahesh confessed that he has used them. So he was given scolding for the same instead of taking him to a counselor. And since then, he is not talking much. On HEDSS, there were many points which were important. There was conflict among parents and the parenting style was neglectful. He wanted to become a CA. He was a member of a theater group, but he is not regular now. He has started smoking 1 year back, smokes once or twice a month, there are no other drugs, and he feels low and lonely. So all these things are going to help us when we counsel the patient. And so taking head assess is very, very important. So in this table, where does he fall? He is a monthly user, so he falls in mild or moderate SUD risk. We have to give him brief intervention and motivational interviewing to reduce the use of this behavior. So screening for comorbidities is very important. He could be having some other psychopathologies. Encouraging to change the behavior and making a plan is our goal. So brief intervention is something which is very cost effective and time efficient strategy, and main aim is only for harm reduction. We are not using it on those who are drug dependent or heavy abusers. It has been shown that such brief interventions reduce the frequency, quantity, and the risk of substances that are abused. Also, there is reduction in doctor visits and emergency visits. So it is a group of strategies. Brief intervention is not one particular type of intervention, and it has to be personalized as per the client. It could be just expressing the concern that, yes, I'm really worried for you, and I hope that you stop it. It could be sharing scientific information that we have discussed. It could be just a simple advice or some practical tips like queue extension, like throwing away um, the cigarette or any other things that are being used for smoking or drinking, throwing away the glasses or something like that. Record keeping also is a very good strategy that could be used. It can also be given in group activities. This explicit scientific information makes a very big impact that, say, in about 2 to 12 weeks, your circulation will improve and your lung function will also improve. So for a person who is a sports person and using smoking for his coping strategy, see, this thing becomes very important. So these brief interventions could also include some structured counseling sessions, which are less than 15 minutes duration. They can be conducted into a primary care setting in the hospitals when they are admitted for some other reasons, at bedside, school, or in community. So coming to motivational interviewing, it has been already quite extensively discussed in the last session. Let us see how it is done for this substance abuse. We all know that motivational interviewing has many principles and there are communication styles and tools there. So the important principles are theirs, which is developing discrepancy. Like if you want to become a CA, you have to study hard, and so you cannot afford to lose your capacities and your memories. So this is a discrepant behavior. Avoiding argumentation, like you don't smoke. Why are you smoking? It is not good for you to smoke. Avoiding of such statements is very important. Rolling with resistance. If the adolescent says, no, I just enjoy, it is very cool for me. So we are not forcing him to change his behavior there and then. We will wait for some change statements to come from his side. Expressing empathy. Yes, I know that there are certain stressors in your life, and supporting self-efficacy. That is, I believe in your capacity to try out reducing on your smoking. Such are the principles that we use in this technique. And also the communication is open-ended. We use affirmations, that is like giving positive remarks, reflections, that is giving letting the patient know that I have understood your point, and then summarizing. So there is also a tool which is called frames, which is very popularly used in substance use, which is, let us see what we can how we can use this tool for Mahesh's case. So F here stands for feedback. Here we give the feedback of the pattern and level of abuse, the harmful effects that the substance is causing, and also we could share some more information. So to Mahesh, you are smoking since almost a year and it is increasing. Only 8 out of 100 students of your age smoke and 92 remain away. Responsibility. Change in substance use is his responsibility and not that of a counselor. So we are all here to help, but ultimately you can only stop holding a cigarette in your hand and taking it to your lips. Advice, direct professional opinion on harms. As a doctor and your well-wisher, I want you to cut down on your smoking since it will affect your studies for CA. Let us chalk out exactly how and how much we can do. So this is developing discrepancy, as I was telling you. So the menu is the various alternative ways and strategies. So all the things we have discussed could be offered. And for Mahesh, he chose to keeping a diary where, when, and with whom he indulges into substance, preparing substance use guidelines for himself, what he will do and what he will not. Some lifestyle changes, and he wanted to go back to theater and something like this. We have to tell him. Now coming to empathy. So I understand that you get disturbed by your parents' differences and you get relief when you smoke. This is a reflective listening. You have understood his point and you have told him that you have understood. I appreciate that you have come here. This is an affirmation that something good has been done on his part. So we shall work together step by step. This is instilling hope, which is a very common thing that we do in every counseling pattern. So self-efficacy is sense of optimism and perceived control and confidence to do certain things. So when while talking with Mahesh, we can always this was a question that was put to him. What are chances that you reduce your smoking? This is an open-ended question. And he said, I may be able to reduce smoking if I take it seriously. As soon as this has come, this is a change statement. He has said that I may be able to reduce. So immediately the counselor has to say, and what will make you take it seriously? What is your willingness on a scale of 0 to 10? This is a scaling question. So we have to appropriately and instantly use the statements that the person makes in changing his behavior and give him a change plan. For Mahesh, we sorted it out like this. The change I want to make is reduce smoking. Most important reason to make this change is I want to become a CA. The specific steps I can plan is keeping a diary and joining theater. People who can support me is my mother. How can she support? By cutting down on my pocket money. I will know my plan is working when I remain sober for 4 weeks. Things that could interfere with my plan, my father smoking, and what could be the possible solution? I will go out when he smokes. So such things have to be written and planned out so that it becomes easy for the adolescent to execute what we want him to do. Coming to case 3 now, he is Bhavesh, who is 18 years and was brought to the hospital for a vehicular accident. He was drunk and driving. His friends told that he has started regularly drinking after his breakup 3 months back. So he is given medical treatment for his wounds and stabilized. What is the risk of SUD in this patient and what should be the next step? So he falls here and he needs a referral to treatment because he is into a severe SUD risk using more than weekly. So what do they do after the referral? After the referral, a multidisciplinary team comes into picture. There are certain biomedical modalities to be taken care of, like detoxification, anti-craving medicines, antagonists, substitution medicines, and some more medical treatment he might need. Then there are psychological intervention techniques, which are various types of counseling and socio-cultural modalities, wherein community is also made a part of rehabilitation. So there are many interventions and we will see some of them. So the brief intervention we discussed just now, which could use frames approach. Motivational improvement therapy is motivational interviewing. Relapse prevention depends on cognitive behavior approach. Networking is involving more people than the individual, maybe the family or the school, and increasing the network. Community reinforcement approach includes behavioral approach, like what makes you, what is the antecedent, the behavior is the drug abuse, and what is the consequence, and we combine contingency management in that. Multisystemic approach teaches life skills and contingency. There is a matrix model, which is a combination of many things that we have been discussing, also including the cognitive behavior. Self-help approach is along with the social networks like the Alcoholic Anonymous. So these are various styles which are used for helping adolescents with severe substance abuse. Important thing is parental psychoeducation. When a parent has when a child has come with the drug abuse and he is into the state of dependence, we have to tell parents that it is a disease and not a lack of willpower or moral weakness. They don't have to argue or quarrel or even justify use of substances, like he is so much under stress and he should be using the substance. It hardly matters, because there is sometimes this conflict. One parent justifies, the other parent will be very angry with the substance use. Also, we don't have to cover up the consequences. We should never suspect or check with friends what he is doing, what he has consumed. All the while, we don't have to do, and not to discuss drinking and drug use problems with others except the professionals. Also, very important for parents is to pay attention to his needs, nutritional, health, education, and all the things. So family therapy also comes into picture, because once the child is into drugs, the whole family gets shattered. And we have to treat family as a unit by improving their communication, resolving their misunderstandings and conflicts, and to make it a more cohesive and functional family, because that is only going to be supportive for the adolescent. So we have to identify the negative interpersonal interactions and rebuild trust. Many times the parents are so much fatigued and annoyed with the adolescent who is using drugs, that we really have to ask them, tell me a time when you were proud of your daughter, so that they go back to some positivity with the child. Tell me a time when your family helped you. This could help the adolescent to connect with the parents and the family. So we have to advise regarding support and rewarding good behavior of each other. Even the adolescent has to be reward the good behavior of the parent, and so they come on one page. Listing a safe versus risk situation and monitoring responses therein makes a very good commitment, and we have to impart the problem solving skills. Coming to lapse and relapse. So lapse is a temporary small slip or a brief period of non-compliance, which is followed by a return. And it is very natural and universal. Whereas relapse is return to previous drug use. So lapse, if unchecked, leads to relapse. So we have to impart education regarding identifying the situations that might be high risk and lead to lapse, and prepare a plan in advance to deal with such situation. So the moods, what are the common relapse precipitants? There are many of them, including the mood states, the behavior, the cognition, like overconfidence. Oh, I can manage it. There could be some environmental things, physiological things like craving, withdrawal symptoms, chronic physical pain for those who are into some physical health issues, and psychiatric conditions. All this could mean uh, all this could be a relapse precipitants. So the simple mnemonic is HALT: hunger, anger, loneliness, and tiredness. If we avoid these four things, then most of the relapses are avoidable. So let us go through a relapse story. Aditi is 17 years and she stopped smoking 1 month back. Now, what happened? She went to a school tour with her friends for a weekend. So this was a high-risk situation. There were no plans of how to handle the situation and couldn't say no to her friends. Small lapse for a weekend happened. She was unhappy first for lapse, and then the negative thinking started. She was thinking that if I can't just enjoy myself for a few days or over a weekend, why should I continue on the plan? Because if I used it only for a few days, only for a weekend, and now I'm feeling so bad about it. And another relapse came, and then there was no comeback. She started smoking to take care of these negative thoughts. After a week, she just left the idea of stopping smoking, and she was into a full relapse. So preventing a lapse from becoming a relapse has to be taught. The first step is to tell that 99% individuals will lapse, but take it as a learning experience. Lapse per se does not cause relapse. Only if you resist the tendency to think negatively, you can save yourself. Revisit what exactly happened. Regain control as early as possible. Don't delay. So don't say that if I had a cigarette over last weekend, let me do it today, and from tomorrow I will again go for a sobriety. That doesn't help. So talk to someone for support and remember positive steps that you have been taking so far. So this is how you have to prepare the adolescent for dealing with a relapse. And that also it is very important to prepare what you will do, how to say no to the friends or any other modalities wherein he can save himself from landing into a lapse. So the take-home messages are every adolescent needs to be screened for substance abuse. Most of them are manageable at primary care level. Brief intervention is a group of strategies to choose from. Motivational intervention works best in adolescent substance use. Pediatricians can be trained for that. And treating SUD is a multimodality plan run by multidisciplinary specialists. So for further reading, these are some of the references that I can share with you. These are very, very resourceful books. And also not to forget our own MKC Nair sir's book on adolescent counseling. These are my references. And thank you so much for your patient listening. I hope I finished it in the given time.
Finished it given time and very nicely too, as usual.
Thank you so much.
Should I
Thanks a
call
lot.
now? I think now role play is going to start now. Ma'am is already there. Yeah, ma'am is. I was about to call you, ma'am. Yeah. And ma'am, you just unmute yourself, ma'am. Let me unmute.
I shall add my rest and I'll listen to last 10 minutes of Swati Ghate's excellent lecture. Okay.
Yeah.
Thank you so much, madam. Thank you.
Geeta, I can't hear you.
Ma'am, your voice is not clear actually. Ma'am, I think you disconnect and reconnect. I suppose your network is not working well.
It's not clear, Kavita.
Yeah, let me call Vivek. Voice is, I think from वहीं से कुछ ऐसा है. मैं विवेक को कॉल करती हूँ, कुछ वहीं से इशू है प्रोबेबली. विवेक ये वॉइस को क्या हो गया ऑल ऑफ सडन? ये जो चल रहा है हमारा वेबिनार, वॉइस अनक्लियर हो गया, पूरा मफिल हो रहा है.
No, the voice is from your side is clear. Who's speaking actually?
Am I audible now?
Yes.
Yeah.
Am I audible? I think
Yes, ma'am.
Yes, अभी ठीक है मैम, अभी ठीक है.
ठीक है.
Start with the first case. I think all of you know that we have learnt a lot now. This 15-year-old boy, Preetham, now he is a regular patient of Dr. Shilpa. Shilpa is going to enact as a doctor and Anita is going to be a adolescent, Preetham. And Preetham is visiting his doctor to seek the fitness certificate as he is going for hiking as it was planned during his school picnic. Now let us see how the doctor utilizes this opportunity guide the teen on substance use. So now over to Dr. Shilpa and Dr. Anita. And Madam will give the comments at the end of all the cases. Yes, over
Yeah.
to Shilpa and Anita.
A very good afternoon, everyone. Ma'am, am I audible?
Yes.
Shall we start, ma'am?
Start.
Hi, Preetham. It's great to see you again. How are you? How's school going?
Yeah, I'm good, doctor. Everything is fine. Keeps me busy, but not bad.
Glad to hear that. You have grown a lot since your last visit. You look very handsome now. So today, should we discuss about your health, school life, friends, or for that matter, anything you would like to talk about? We will also check in on a few important points which is quite essential at your age, maybe like stress, relationships, and choices around substances like alcohol, vaping, or drugs. Does it sound all right?
Yeah, that's fine.
Great. Great. Just to remind you, a conversation will remain private if you wish so, and I won't share what we talk about with your parents until and unless there is a safety concern. Does that make sense?
Okay, I get it, and I trust you.
Okay, cool. So, some teens are curious about things like smoking, drinking, or even experimenting with substances. Have you ever been offered anything like that by your friends or classmates?
Yeah, I've seen people vaping at school also, and I've seen many of my friends discuss about this, about the parties also, but I haven't been into anything of that sort.
Thanks for being honest. I agree, that's really common. And I appreciate you for sharing. What do you think when you see people vaping or using substances?
I don't know why they do it. It's for me, it looks like kind of dumb, but a lot of it is going everywhere these days, and it kind of seems normal.
Yeah, I totally understand. It can feel like everyone is doing it. But actually, not to use substance is totally your choice. Can I share some interesting facts about this, even if you're not using it?
Yeah.
We generally say that the child is able to wear his father's hat by around 5 years, meaning to say your brain size has reached that of an adult. Although you feel you're all grown up, your brain is still developing, especially those parts that help with decision making and impulse control. So you can see this in this simple image. Using substances like alcohol, nicotine, weed, or other drugs during teen years can interfere with your brain development and can also increase the chances of problems like anxiety, depression, and later on even lead to addiction.
Oh, really? Is it? I didn't know it could affect our brain like that.
Yeah, it's pretty wild. Yes, Pritham, you wanted to say something?
No, thanks for sharing this information. I didn't know this before.
Yes. So actually, vaping, for example, often contains nicotine, which is super addictive, even more so in teens. It can even harm your lungs. By the way, Preetham, do you know hiking at higher altitudes requires your lung power?
Yes, absolutely. That requires a good lung power and stamina, physical stamina also.
I
And
hope all this is
hence,
making
whatever
sense.
explanation you have given makes sense. And anyways, I'm not into that stuff, so pretty cool, I guess.
That's awesome to hear. It's smart to stay clear, but at times friends can pressurize you. And if someone offers you something, do you have a plan as to how to respond?
I guess maybe I can just say that I'm not interested, or maybe pretend that I have something to do the next day, maybe to study or go somewhere with my parents. I can use pretty good excuses, I guess.
Okay, so that's a solid start. Some teens also like to have a phrase which is generally ready, like, for example, I am good. My mother will screw me, or maybe saying things like, like you already said, like you have practice, or sometimes you can even blame it on me, saying my doctor would kill me. Whatever works for you.
Yeah, I can use some of these excuses also. Thank you, doctor.
Perfect. And hey, remember, Preetham, if you ever try something or you feel stuck, you can always come and talk to me. Remember, I will not judge you. I just want to help you so that you can stay safe and healthy.
Thank you, doctor. Thank you for the trust you have built with me. And I'll always look forward. If any problem occurs, I'll definitely approach you.
You're always welcome, Preetham. I'm really glad we had this talk today. So now let's get going with the rest of the checkup.
You.
Thank you very much, Dr. Shilpa. And
Yes.
you have taken a great opportunity to reinforce his positive behavior. And this is the first case.
Ma'am.
Dr. Swati?
Yes,
Dr.
madam.
Swati,
Yeah,
Yes.
I think it was very well portrayed. And in my presentation, I will give some more highlights. But I think there's just a generation gap. I think Shilpa is much, much younger and she uses the adolescent lingo. But I'm not sure whether I would say my mother would screw me. That is the only thing.
Yes.
Other things I will emphasize when I'm giving my thing, but very well done. Most of the points you covered very well. I'll comment more on my presentation. Yeah.
Right. So now we are coming to the second case. Now Shilpa is going to play Amay, and so she is in a different attire now. Great. So stethoscope has gone, and she is now into a jacket. That's fine. And Dr. Anita will be Dr. Rao now. So this is about Amay, who is 16 and who has been brought for a routine checkup. During his visit, he reveals that he occasionally engages in vaping and smoking marijuana. Recognizing this as an opportunity for preventive health intervention, the Dr. Rao employs motivational interviewing techniques in a non-judgmental way. The goal is to help Amaya consider the potential benefits of change by eliciting his own motivation and concerns rather than by lecturing or prescribing a solution. So let us see how it is done live here. Welcome, Dr. Anita and Dr. Shilpa.
Hi, Amai. Thanks for being open with me today. You mentioned you have been using vaping and using weed sometimes. Can you tell me more about this?
Yep, I vape pretty often and I sometimes weed with friends, but mostly on weekends. It's not like I do it every day or anything.
Okay, got it. Sounds like it's more of a social thing for you. What do you enjoy about it?
I don't know. I think it helps me chill out. Uh, Things can get a lot of stressful with school and stuff, and honestly, all my friends do it.
Okay, that means you're doing it to deal with stress and you're also trying to fit in with your peers, right? That's a lot. So, can I ask on a scale of 1 to 10, how important is it to you to keep using right now?
Mm, Maybe a one.
Okay. Why a 1 and not a 10?
Well, I guess it's not the healthiest thing. Maybe my mom would kill me if she would found out about this. And sometimes I do kind of worry of getting caught at school or in front of my family.
Okay, you have several concerns also. It sounds like a part of you has already questioned whether you are really doing the right thing or not. Would it be okay if I share a little about what we know from the research?
Yeah, sure.
Thanks. So for teens especially, indeed, substances like weed and nicotine can actually change how the brain develops, especially parts that control the memory, attention, and mood. And I guess you're a good student and you perform well in studies. So it might feel good in that moment, but over time it can lead to more stress. And I also see that it is as you have already told, it seems like an easy way to cope up with stress. We should consider that, and we should consider alternate ways of reducing your stress. And you have to remember that using substances can reduce your memory, attention, and memory recall also, and it is going to impact your academic performance.
Yeah, okay, is it? I really didn't think about all these things and that it could mess with my brain. That kind of sucks.
Yeah, you have to consider all these things. And so, if you think of a change, what is one small thing you might be willing to try? Maybe cutting back a little or finding another way to de-stress yourself?
Mm, maybe I could probably try vaping less during the week, or maybe just stick to the weekends.
Okay, what
Or
all can you try to de-stress yourself instead of using things?
I can play video games
Wonderful.
just to unwind. Yeah.
Anything else? Because that is going to increase your screen time, right? You need to have more options. Can you tell me more
I love
options?
playing cricket actually.
Wonderful.
Yeah.
Wonderful. The sports will do wonders. So those are really good practical ideas. So focusing on cutting back during the week sounds awesome. That is the first step. How would you feel about checking on that? Shall we start doing it?
Yeah, okay.
Great. So we'll meet after a few weeks and see how you're doing and adjusting to the things and how you're coping up with all the changes you have made in your life. And you're being very honest, and I really appreciate that. And I'll be always there to support in whatever steps you are taking ahead. Okay, for your
Okay.
overall good.
Okay. That sounds great, Doc. Thank you.
Thank you. And it takes I really appreciate you, and it takes a lot of guts to discuss these things with the healthcare professional like me. So just let us keep this trust going on, and future will be better for you.
Sure, Doc.
So see you again later.
Shilpa, great lingo, adolescent lingo. So you talked very well. Madam, I think
Your voice is low.
Geeta madam, it's
Yeah.
difficult to hear you.
Madam has to give her.
Yeah, this is a very sensitive point about the safety issue when we give confidentiality to the adolescent, that I will not tell your parents unless there's a safety issue. I would like a discussion at the end, let the role plays get over, whether a minor telling you that he's weekend recreational taking weeds on a regular basis, should this be taken as a safety issue, and should the parents be involved, or you should just continue that trust? Or should you tell the child that you've been very honest with me, but it's time that your parents also know about it, etc., etc.? It's a very gray area and it needs a discussion. So we'll keep it at the end. Okay. Otherwise, the role play was very good. Everything well done. The way you had a rapport, you told him everything, that was fine. But this is a medical legal issue, and this is something which comes in our practice, and hence a little more discussion on that will be useful to the participants.
Yes.
Geeta ma'am, we can't hear you.
Again, I think there is some problem.
So shall I read out, madam, the introduction? Shall I get the introduction done? Geeta madam?
Yes, ma'am. Please, ma'am.
Am I heard?
Yes, ma'am.
Yes.
So now start the third case. Now the star cast has changed. We have got 3 people now. So this is the case. 16 years old, was recently caught using cannabis at school, and mother is going to be acted. I think Dr. Swati is going to be a mother, and she is very concerned, Mrs. Sharma, and emotionally very overwhelmed. She's in the tears, and Anita and Shilpa, they are going to have a role reverse and are going to help both Ravi as well as Mrs. Sharma to understand and challenge the irrational belief in order to promote the healthy emotional and behavioral change. It is about REBT. And over to now Dr. Swati, Shilpa, and Dr. Anita for the next role play. How to manage with the REBT. So over to Swati.
Yes.
Yes.
So, good afternoon, Ravi and Mrs. Sharma. Thanks for coming in today. Today, I want to create a safe, respectful space for both of you. We are here to understand what has happened, what is happening, and what we can do. Some healthier ways of coping and communicating. Ravi, would you like to start? What happened?
I don't know what to say. Everyone is acting like I committed a crime. It was just weed. Everyone in school does it. It's not a big deal.
It is a big deal. You are just 16. You have your whole life ahead of you. What if this ruins your future? I feel like I'm losing my son.
Okay, now I heard both of you. Ravi, you're feeling judged and misunderstood. And Mrs. Sharma, you're scared and hurt. Now let us try to understand what happened. Ravi, can you tell me exactly what happened?
Actually, I got caught smoking weed behind the school. A teacher saw us and she called my mom. And then all this non-stop nonsense started.
Oh, okay. What were your thoughts at that time?
I thought I had to do it. If I said no, the others would think that I am weak or not cool enough and I would be left out.
Oh, thank you for being so honest. That thought that I must be accepted by my peers and all at all cost is what is called an irrational belief. Why do you think it's bad to be seen as not cool by them? Why do you get that thought?
Because then no one will want to hang out with me. I'll be all alone and that would suck.
Yes, I can understand. Because being left alone by your friends group is definitely going to hurt. But does that brief moment of being left alone, does it make you worthless? Does that mean that you are good for nothing? Or does that mean that no one will ever like you or get together with you? They will leave you forever?
Uh, Maybe I guess not, but it still feels terrible.
Of course, I understand because feeling rejected definitely hurts. But let us work for a new belief. I want to be liked, but I don't have to harm myself or break the rules to earn that. So, how do you feel about this statement? How do you feel about this thought?
Mm, yeah, it makes more sense. But yes, it's hard.
Definitely, it's hard. It's not so easy. Whenever we have new beliefs, you need to work a lot to accept that and make others also understand that. But this thought gives you more control because it gives you a whole identity that this is me, this is what I am, this is how I want everyone to accept me as. Okay, so that thought you have to be reinforcing yourself to be accepted by others. That gives you a identity for yourself. Please consider that, take a look at it, and let's work on that. So, Mrs. Sharma, can we explore your belief? What went in your mind when you heard that Ravi was using drugs?
It was very shocking. I thought I failed as a mother. I think he has, I thought he has no future now and he will be an addict. And what all people in my family and my society will call, what they will say, tell about me. I was very much disturbed.
Yeah, that's really painful and powerful thoughts. But is it rational to say that one single mistake by Ravi equals to a total failure on the part of Ravi and on the part of you as a parent? Do you justify
Mm,
this?
Maybe not, but then I felt that way.
But at that moment, it is understandable. But can you think of any other thoughts which might be helpful to both you and Ravi?
Maybe I can say that this is really serious and we need to work on that. Maybe he needs help and I need to get involved and stop him being an addict.
And also, I think you should also think that this is not the end of the world and this is not the end of everything. And he needs help, but not the blame, right?
Right.
Can
You are
you
very right, doctor.
can we rethink in that direction?
Very
Okay.
nice. Very right.
Thank you. Thank you for trusting me. With this belief, we can support Ravi with setting a few firm boundaries. Okay. It's not the events, but our beliefs about them that drive how we feel and act. Let's work on some strategies together for Ravi to cope up with peer pressure and for you, Mrs. Sharma, to manage your fears and responses. Would you be both open for that? Can we plan,
Yes.
can we plan ahead?
Yes, definitely, doctor. This looks promising and hopeful.
Wonderful. Let's go ahead and create a plan for both of you.
Thank you so much. We will come next week.
Thank you.
Madam, input.
Very good. Very well done, all three of them.
I think this is about REBT. I think very good,
Thank you.
absolute must that everybody should accept you, and everybody should be good to you. World should be good to you. All these things you have very much elaborated here, and you have used a very good tool, disputation tool. So great. I think, madam, you are some more comments about these things.
No, I think learning CBT and REBT is extremely important. And all of us who are doing adolescent counseling may not become therapists in CBT and REBT, but we must know the principles so we can use the principles in our counseling. And unless you have really been trained as a CBT or REBT, if anybody requires prolonged CBT and REBT, like they've got OCD or some problem, then it is good to have some trained person in REBT or CBT. But the approach of REBT and CBT is extremely useful for our counseling. And I think we should use that because it's a well established mode of therapy.
Anything, madam, you are going to present?
Yeah, can I share my screen?
Yes, ma'am.
Okay. Can you all see?
Yes, madam.
Okay. So now, both Geeta and Swati have given so much excellent information about counseling and all the detailed theory as well as practical has been done. And the role plays by Anita, Shilpa, and Swati have been excellent. So I'm just trying to give you some tips about my experience because I've been very fortunate to see adolescents across many socioeconomic groups. I started way back when IAP adolescent chapter was not even formed. In 1991, I started a weekly adolescent clinic in Bombay Hospital, which I ran for 10 years. And then when I shifted to Delhi, I totally came out of pediatric clinical practice and I started a home-based clinic at parental guidance and adolescent. And since 2015, I'm running an adolescent clinic at Jahangir Hospital. And since last 2 years, my dream of holistic care to adolescents under one roof, which I call Family Guidance Center and Adolescent Wellness. And we have a psychiatrist, a clinical psychologist, and an adolescent expert, and myself, who see all the cases as a team. And we are giving holistic care. And so I've really seen land, and I've been doing teleconsultations more than 350 now in the last 3-4 years. And I was working in Sassoon in the adolescent clinic OPD, where I've seen slum children and children from things. So across Delhi, Bombay, Pune, and across various socioeconomic groups, I've seen the substance abuse spectrum just changing over 35 years. When I started my practice in Bombay Hospital, substance abuse, I was in the city of Bombay. And we all know in metro cities, substance abuse is far more rampant. And the rave parties were there even those days. But it was much, much lesser. And today, when I'm practicing in Pune, especially last 5 years, substance abuse has become very rampant. And as was brought out by Shilpa and all that, children don't think it is something great if they do weed or they smoke or they drink because it has become like a new normal for them. And hence, when we become so serious about substance abuse, the children don't understand why are the adults getting so, as they say, chill, chill. Why are you getting so hepped up of these experimentations, etc.? So it's a real rampant thing which is there. And Geeta has given the statistics also. So we all have to really understand the new era, what the way children or teenagers look at substance abuse and the way we as adults and experts know the problems which are going to occur in their future with the brain development, with the addiction. So it's a very tricky and very difficult thing. Now, I'm giving my protocol. It may not be the right protocol for everybody, it may not be practical or feasible. But in my mind, family guidance clinic, I never take the adolescent directly, especially if he's below 18 years, which is a minor. So we insist on taking the parental session first. And I would always encourage the parents to come together. But as we know, men think psychology mumbo jumbo and they don't like counselors. They feel that we can take care of our own problems and why do you need to go to a counselor? But women are more akin to finding help and taking professional help. So majority of the times is the mother who comes to me for the parental session. And then after some time, when the family sees the difference being made after the child and mother coming, very often fathers join in. So why do I take this first parental session? Why do I insist that I would not like to see an adolescent until I've seen the child? Because it's very important to get the parental perspective. And I take a real deep history from the preconception period, antenatal, postnatal, the complete developmental milestones, because I want to know the personality of this child. I want to know the environment of this child. I want to know what all childhood trauma he has undergone, both physical, mental, etc. So by the time I have had the parental session, I've got a good idea of the environment this child has been brought up, the parental behavior, the type of parenting, and I can make out marital discord in the first 10 minutes. Because if there's a marital discord, you will find the parents fighting with each other, contradicting each other, and you can understand that if this is going on within 15 minutes of a session, what must be happening at home? And this becomes discordant parenting because one parent has certain beliefs, the other parent is contradicting, and the children are confused and they're very smart to manipulate. So they know what to get from the mother and what to get from the father. So this parental session gives a lot of idea about the family dynamics, and hence it becomes like a basis before I take the adolescent. As I said, this is my protocol.
Can you make it full screen, madam? Full screen. It is
Yeah,
not
1
full
minute, huh?
screen.
Trying to get full screen. Huh? Now is it okay?
Yes, yes, ma'am.
Okay. So as I said, this is my protocol and I've been doing it for the last many years. When I do full screen, I can't go ahead. It's getting stuck.
Okay.
This had happened last time also on this thing, you know.
Yes.
So I'll have to do this only, unfortunately.
Okay.
Okay. So now you all have in the previous lectures, Geeta and Swati have highlighted the risk factors. All adolescents don't go for substance abuse. So which are the risk factors which we see? As has been highlighted before also, dysfunctional families. Then there's marital discord, children are insecure, children are unhappy. Substance abuse becomes a way of stroking themselves and finding happiness. And parental use. If a father is smoking, they're having drinks in the family, it becomes like a familial pattern. And very important to understand that substance abuse is very often seen when a person has mental health issues. This could be simple anxiety disorders or depression, or it could be serious psychiatric disorders. And hence, whenever a child comes with substance abuse, one has to assess the child whether he has any psychiatric disorders and whether he has any comorbidities. The second, dopamine reward pathway has been very well explained. And we know that once a child or an adult goes into a dopamine reward pathway, he becomes an addictive personality, as we call as dopamine junkies. And whenever you try to remove one addiction, it gets replaced by another. That means if you try to stop his smoking, he may go into drinking. If you try to stop his smoking and drinking, he may go into gaming. And hence it's very important to understand that this has become now an addictive personality and this is a dopamine reward. And you have to be in a multifaceted way, see that he doesn't go into another addiction. And very often I've seen children who get one addiction, they come out and they go into another addiction. And this is something which you all have to watch for. And inability to cope up with failures and rejections, like romantic breakup, or not doing well in an examination, or not passing NEET or JEE and feeling that their life has ended. All these are very, very important things why children go to substance abuse, apart from experimentation and peer pressure. Now, if you take families, again, I'm not trying to generalize, but from my experience of 35 years, that in middle income groups, where both the parents are educated, they have limited salary, and they have a little more contact with the parents, and they have little grandparents also there, there is little more stability, there is more parental monitoring, and there's less money. And all this has less chance of substance abuse. It doesn't mean that these families do not have substance abuse. There are outliers. But in my slum OPDs, which I saw, in slums, children very quickly have vulnerability to substance addiction because brown sugar, etc., is much cheaply available. And there are a lot of criminal elements in that area who use juveniles for drug trafficking. As we all know that juvenile crimes are less punished as compared to adult crimes. So drug peddlers always use juveniles for drug peddling, and they make children addicts because once they become addicts, to feed their addiction, they are going to start drug peddling. The other thing I've seen, that I have been working in 5 corporate hospitals, and the very elite, especially you've seen Bollywood stars or big business families and all, when there's a lot of money and there's a lot of freedom given to children, and they have their own cars, they have their own entrances, they are not very much supervised, these children are targeted by drug peddlers because they know that these are the children who have enough money and less supervision. And once they get into the drug addiction, these are our permanent victims. And I'm sure many of you also have heard of peer drug peddlers. That means what they do is that if a child, first they'll get him addicted, and then to feed his habit, when he has no more money or something, they will say, okay, we'll give you free of charge the drugs, provided you get your friends involved. And this is very often seen whenever I go to USA. I've got French children who have got into all this, that these school children then tell their friends that, there's a free party, why don't you come over? And then this is the chain which goes on, and children are making their own friends into drug addiction and substance abuse. And that is why it's so important to know where your child is going, who are his friends, are they going by these parties, and all this is extremely important, because peer pressure is not just normal children peer pressure, which we can teach our children how to cope up. But these are drug peddlers who are children who are now so much into the drug habits that they are now trained by these drug peddlers how to make other children into drugs. And I've got a lot of cases like this, unfortunately. Now, how do I get substance abuse cases? I'm sure this is the way most of you get, that the parents have caught the teen smoking, drinking, or using drugs by the smell on the mouth, or they have seen the child in class. Sometimes the mother, or very often the maid servant who's cleaning the room of the child, has found cigarettes or vaping materials or powders accidentally discovered, or parents who have got some flag signs and they've actively gone and checked the child's room when the child has gone to school or college, or he's caught in the school. So parents are called by the school and brought for counseling, like was shown in one of the role plays, or parents bring the teen not for substance abuse but for deterring academic performance or change in behavior, sleep, appetite, etc. And when we have the adolescent session and we give them confidentiality, then the child comes up to say, yes, I am into substance abuse. Now, some certain tips, Swati has very nicely brought out the model. So when a child says never, there are certain things we must remember as counseling. It could be a genuine answer. That means the child has really never tried it, or the child is not admitting it. And hence, in the first session, when you take heads, we still don't have a very good rapport. So, or it may come in some children open up in the first session and they're very honest and they would like to tell everything. Some children take time to open up. So if you are suspecting drug abuse, there are some flag signs. Don't push it in the first session. Wait to develop a rapport. And then when the little rapport is developed, you revisit it and say that, last time you told me that you never have experimented, but I think I have a feeling you have. Would you like to open up? And then the children open up. If the child says never, you congratulate the child and ask, and again that's shown in very well in the role play. But I had a little more questions to ask, that if you ask them, why did they not feel like experimenting and how did they cope up with the peer pressure? And the answers which they give gives you a lot about the child's personality, the connection of the parental child connection, and the future risk of this child going from never into experimentation. For example, if a child says, I'm scared of my parents and punishment, or the school is very strict, I would worry, because this child is not doing it because he thinks it is wrong or it is unhealthy, but he's just scared of parents and punishment. And this child may be sometimes lured by negative peer pressure into experimentation, and then this is a child who will lie to his parents, because he's so scared of the punishment that he'll never tell his parents, but he will try to do something under peer pressure. If school is very strict, the child will not do it in school, but then he will find school friends outside school environment, in a mall or in a pub or some garden or somewhere where he'll experiment. If he says, I can't afford, I don't have enough pocket money, again I would worry, because then under pressure he may start stealing money. And this I've got many instances where they steal from the father's wallet or the mother's purse to feed this habit. And hence, when I get such answers, for me, my antenna are alert that this child has to be counseled in a very different way. But if I get an answer, I don't want to hurt or disappoint my parents, because they have explained to me, and I value that image of my father's reputation or mother's reputation, my family reputation is important to me. Or I know that such I'm not doing it because I have good information that they can cause harm to me, both physically and mentally, on my growing body and my developing brain. Now, these two are more likely to sustain this child into the never stage than going into experimentation. And hence, we should ask the child when he says never, how have you kept away? What is the reason? And you'll get a lot of answers, and it's worth spending about 5 minutes on this aspect. Second, yeah, never miss the opportunity for preventive counseling and anticipatory guidance. And I think in the role plays, both Shilpa and Anita have brought out this very well, that they gave enough information about the harmful effects. But I do it in a little different way. I first ask, oh, how much do you know? Because it's 90% of the time the children come out with a lot of things. And this I learned very early when my son was just 12 years old, and he came and one day asked me, Mom, I want to know all about homosexuality. And first I said, let me know how much he understands. So I said, why don't you first tell me what you know? And I didn't have to open my mouth. He had enough information from his peers, and some of it were myths, which I just told him that this is not the correct thing. So instead of giving guidance and all, just ask, how much do you know about the harmful effects of tobacco and alcohol? So that you know whatever they know, and then you reinforce it. Very good. You know a lot of it. And whatever they don't, then you supplement it. Because it is also another way of reinforcing, positive reinforcement of validating what they know, scientifically validating it, and displays any myths. And if she says no, then of course what Shilpa and Anita did very well was explaining to them about the brain development, the amygdala, but what we have to remember is, whatever messages we are giving, it has to be based on the cognitive maturity of that child. Because we know about concrete thinking and abstract thinking. And though we say that abstract thinking will develop from 12 to 14 years old, there are some children who develop abstract thinking much earlier. They're emotionally, cognitively more mature. And I've seen even at 15, some teenagers are still emotionally immature. They have not developed the cognitive thinking of abstract. So telling a 12-year-old that tobacco will give you cancer is very, very far-fetched and abstract. Because I've got teenagers saying, Auntie, कल बॉम्ब गिरेगा तो हम सब मर जाएंगे, क्या फर्क पड़ता है, कैंसर कब होगा, वो 20 साल के बाद होगा. So telling such things, cardiovascular illness, all that is very abstract for a 12-year-old, and hence you have to give messages for his cognitive concrete thinking, which again Shilpa and Anita did well about the football practice or hiking. Because if you tell them that their lung capacity will be reduced, they will not be able to participate in the sport of their choice, that hits much more, for a child who's happy in sports. Or a person who has got a lot of body image, that you'll get acne, or you'll have wrinkles on your face, or your mouth will smell, and girls will not want to come near you, or boys will not want to come near you. These are more concrete things at that particular age. So our health messages, when we are talking about substance abuse, tobacco, alcohol, also have to be totally based on the cognitive maturity. One glove doesn't fit all. And that is what we have to remember. Second, most children, if you ask them what they only know tobacco cancer, and they only know liver cirrhosis from alcohol. And they really don't know that every artery of the body is affected by nicotine. And we tell them, lady, nicotine stimulates and then paralyzes. And once they know that nicotine can affect the vessels in the heart, giving premature heart attacks, it can give premature strokes, they can get gangrene like diabetes, they can get premature sexual dysfunction, it can cause ejaculation dysfunction. All this is not known to the adolescents. And we talk about fetal alcohol syndrome. We talk about what happens when a woman smokes during pregnancy. And we talk about second-hand tobacco smoke, third-hand tobacco smoke. All this is really very important, which they are not really aware. And depending on the cognitive maturity, don't miss the opportunity of preventive counseling and anticipatory guidance. And then very important that don't work with a substance abuse case single-handedly, because it's a very, very complex issue. As adolescent pediatricians, unless we are trained in de-addiction, we are not capable of handling these cases only by counseling. And hence, learn to work with a team. And if you have a serious drug abuse, you have to refer to a psychiatrist and a clinical psychologist. And I'm very fortunate that I have this team on hand where we jointly counsel and manage a patient with a psychiatrist, clinical psychologist, and myself sitting together. Many substance abuse cases have an underlying psychiatric condition and comorbidities, and it's very important to assess that and have a complete holistic approach. You can suspect the diagnosis by the flag signs you get from the history and the parents, but confirmation of an underlying psychiatric disorder is extremely important. And these cases require a number of psychiatric drugs in combination, because he may be having OCD, he may be having ADHD, he may be having borderline personality disorder. And this combination drugs, unless you are very aware, most pediatricians, we are not used to giving so many psychiatric drugs. So we need to learn about it, sit with your psychiatrist, understand it. So gradually you will develop the expertise and confidence of knowing that your patient is on that, and you know. And of course, a clinical psychologist can help, especially when there's a prolonged CBT or REBT required, or doing personality tests like MMPI and other things. So substance abuse has to be handled as a team and not a single person alone. Serious drug addictions are not easy to treat. As Swati has said, there can be lapses, but relapses. So that these relapses can, I have got cases who have had repeated rehabilitation and indoor admissions. I'm dealing with heart-rending cases of such teens and their families, and the parents require tremendous support in guiding and counseling. The parents are really distressed and going through tremendous mental agony and financial stress. Please remember, rehabs are not cheap. De-addiction treatment is very prolonged and very costly. And especially if they are middle class or little lower income patients, it is not easy for them to do this. So I'm just sharing a few of my cases. Swati has already given you a lot of cases, but I'm just doing one or two just to highlight. So during my teleconsultation, right when COVID began somewhere in April, May 2020, a mother called me for teleconsultation. She was distressed as she found a 17-year-old smoking and drinking. The father had a huge supply in the home bar, and he was unaware of his stock diminishing. The son was very smart, especially vodka and gin, it looks like water. So he used to take vodka and gin, replace it with water. So his father did not even know that his vodka and gin is getting diluted. And he used to take just one peg from a rum bottle, one peg from a whiskey bottle. So the father was not even aware that his stock is diminishing. And when I did the teleconsultation to the son, he was feeling very low and frustrated. He was appearing for a competitive exam and he was not very sure he'll pass. And every evening his father used to smoke and drink. And he justified that his business was going down. He is very stressed and he needs this to cope up. So this was a role modeling for the child. And he says, if my father finds relief with smoking and drinking, why should I not do it? And within another 6 months, I'm going to be 18 years old and I'm not answerable to my parents. So I had to have a teleconsultation with the father. Luckily, he came. I could motivate him to do good role modeling. I could advise him of healthy ways of coping with stress. And since this was COVID time, there was a lockdown, I taught the family how to de-stress together with family activities like family yoga, family dancing, family board games. And since this was a beginning, the child could come out. So role modeling of the father was a very unhealthy way of coping with stress. It was easy availability at home. And as Geeta said, alcohol and tobacco are gateway drugs. And these lead to more serious drug issue. And hence we have to take experimentation with tobacco and alcohol seriously and sort of take care of all this. Pop culture. I don't know how many of you, I think in Bangalore, Bombay, Pune, I learned a lot of new things about pop culture from my patients and from their parents. Pubs in Pune are creating false identity cards showing a 14-year-old as an 18-year-old. They create college IDs, and these children then very legally go with these IDs, and how do they create it? Through peers again. This is all peer addiction. And these touts offer them to create such an ID card, and then they can go to any pub and they are served liquor very openly because they are adults. Girls are taking vodka shots far more than boys, and it is taken very modern hip. And you must have seen that serial, Four Shots of Vodka. I saw that whole serial, and I was quite shocked at the way things are going and accepted in the society today. Many of these children, after the parents are asleep, at about 1 or 2 a.m., they sneak out of the house, they use the family car, underage driving, then they go to the pub, then they do underage driving and drinking and are home by 4 a.m. And you know the recent Porsche case of Pune, it has been well documented and well advertised on TV, where not only the child was underage, under drinking, committed a crime, and the parents tried to cover it up by mother giving her blood sample and exchange it for her son. And doctors in Sassoon were arrested for the fraud, and this is going on. And that boy just got a judge, juvenile justice judge, saying, write a essay how I should not be doing it, and this case is still on. So we are getting more and more such cases of underage drinking, underage driving, and permissiveness by the parents. So now I have a lot of success stories, but I'm going to share some of the stories which have been very difficult. I had a 14-year-old girl brought by the mother. She was extremely beautiful. I mean, she could go as an actress or a model. She was that beautiful. Multi-talented girl, doing very well in very extracurricular activities. Not much interest in studies, though she used to pass because she was quite intelligent. Both parents very affluent, very busy in their careers. Father very often on international tours. This child had a big bungalow. The child has a separate entrance to the ground floor. She could come and go whenever she wanted. She had a breakup, so she started taking weed, and then she started having friends who were college girls. This girl was only 14, and she made friends with college girls, and then she started doing hardcore drugs. And we have been struggling with this child for the last 4 years. And she goes into rehab and relapses, and now she's 18 years old, and now legally she can say, I don't want to take treatment. And this is something which we are struggling, and the mother has become a close friend, and it's not easy to cope up with this girl. A issue which I faced in family guidance, and I think some of the people also had put a chat, and I would like to discuss. In some elite families, father offers drinks to son around 16 to 17 years for various reasons. It is better that he tastes drinks under my supervision and knows how to handle drinks rather than succumb to a peer pressure, do experimentation, and have some acute toxic episodes. I can teach him the do's and don'ts. He's going to drink anyway once he becomes 18 years, and this is to avoid problematic drinking, akin to teaching a child safe sex. So let us have some audience interaction before I go to my case. Do you agree with this? Do you disagree with this? What will you tell such a father? Just put up your hands and 3, 4 people can just discuss. We can start with Kavita, our coordinator. What would you talk to such a father?
Ma'am, this I see in my relatives also. It's very common culture that parents and they allow and they drink with their children. But personally, I'm not comfortable with that culture because that is like promotion. We are promoting our children to take it. And it's not at all like a safeguard that then they won't go for the poor drugs and all that. So for me, I'm not like comfortable with this kind of culture.
Yeah,
But
Geeta,
yeah,
Swati.
talking with them and pros and cons and all that, that I do.
Yeah. Swati, Geeta, Shilpa, like your comments on this?
So this is
Yes.
who is going to talk? I think this is a permissive parenting. I can say that father is drinking with the son, thinking that it is done under his supervision. He will not be able to. He will not do it outside. So. mm, Definitely, this is not the right way of the approach. That parenting itself is a problem. That it is a permissive parenting, and father is not discussing with his son about the real problems of the substance abuse. Rather than he is uh, encouraging him to drink with him. That is the norm happening everywhere nowadays. But as Kavita told, we are not comfortable with that. We don't agree with this, and we'll tell father to discuss. In fact, what are the problems of the substance abuse, and he himself should refrain from drinking, not in front of son, otherwise also.
Shilpa?
I do agree with what Geeta ma'am and Kavita ma'am have told, ma'am. But then there are issues with like getting the father to change his behavior. That might pose a challenge, is what I feel. Uh, because generally they might say like once, like we were telling this brain development and these things. So now once he is mature, he might not go into addiction, and he might know to, this is how they might justify, ma'am. So there, I think it requires strong what counseling skills to put the father back on track.
Yeah. Swati? After
Yes.
Swati, I'll make comments. Yeah.
Even I have a feeling that this is not to be done. It is illegal in the first place. So you are teaching that something illegal is okay in this house. So he might go into some other illegal things. Secondly, the father needs to know that like the pretext is that he should not fall prey to peer pressure and try it out outside the premises of the family. So we can always tell them that you should tell the adolescent to try it, but at a later stage, at a later age. So postponing the trial is something which is which should go. The way should go. We cannot say that you don't do it at all. Maybe a responsible trial at a responsible age could be a way out.
Okay, I'll make comments on this. Thank you for all your input. I'll just give you a case which I had. This was a 16-year-old boy brought to my adolescent clinic by parents. Teen was not sleeping well. And their only thing, Dr. Bhave, can you give him some sleeping pills? So I said, I don't just prescribe sleeping pills. I need to have a session with you as well as the child. They're not very keen giving me history of the heads also, but I had to insist. So the background was the only son of a very affluent family in Pune. 1 month ago, he had his own Honda Civic, but at night, he took his father's Mercedes without permission and he drove to the pub and back. And while coming back, he banged against a divider and a pole and totally totaled his Mercedes. It was a very bad accident. Luckily, he and his person who was next to him did not get injured, but the Mercedes was totally thing. Parents were not much concerned. He said, मैडम इंश्योरेंस से हो जाएगा, कोई प्रॉब्लम नहीं है उसका. और हम भी ऐसा ड्रिंकिंग और ड्राइविंग करते थे टीनेज हमारे में, लेकिन कुछ प्रॉब्लम नहीं हुआ, एक्सपेरिमेंटेशन था, वी आर ऑल राइट. और किसी को मारा नहीं है तो ठीक है, आप उसको स्लीपिंग टैबलेट दीजिए. वी आर मोर कंसर्न अबाउट हिज स्लीपिंग टैबलेट. So I had to tell about the alcohol addiction. He said he's not an addict. His home bar is full, but he doesn't even touch alcohol during the week. He only drinks on weekends. And he said, I must enjoy on weekends. Our whole social circle does it. We are okay. My parents also don't mind. And ma'am, I'm very smart. I know how drug abuse can harm. So I don't do drugs. I only do alcohol. I don't smoke also. So he was like in total control about his feeling that he's not an addict and he's got his alcohol totally under control. He definitely had PTSD. He was getting nightmares of that serious car accident. And that was the reason he was not sleeping. And however, I tried to explain to the parents, they were not really understanding that he requires a referral and a counseling. But the only way I could do it, I said, I'm not a psychiatrist. I don't prescribe sleeping pills. And if you want the pills, you have to go to a psychiatrist. So then for that sleeping pills, they went to a psychiatrist. Psychiatrist also tried his best, but they said they're not interested in dealing with help with alcohol. This is just part of growing up. Just give us the sleeping pills. So the psychiatrist again said, okay, I don't prescribe sleeping pills like that. I need you to come for a session. This was just before COVID shut down. I stopped my practice for some time. So that I was not going to the hospital and they didn't contact me afterwards. Now, what do we do with such parenting? I mean, how do we ever deal with such a child? And I have got that 3-4 cases. So we may blame the adolescent, but we have to understand that he is the product of his environment from where he's coming. And today, if you notice, I'll just stop sharing. Today, if you notice that all the family parties, functions are not without alcohol. Our marriages are with alcohol, or even religious festivals are with alcohol. And unless we change this milieu, the teenagers are going to say, if adults are drinking, why not us? So the only way to talk to them is say, okay, postpone your experimentation, postpone your trying till you're 21 years old. And as Geeta said, that even the legal age of drinking varies from state to state. Everywhere it is not 18 years, somewhere is 21 years and somewhere is 25 years. So it's a very difficult area. It's a very gray area. Taking them away from substance abuse is very easy, but problematic or drinking or responsible drinking is a big problem of today. And all of us, I think, no, Swati, we should come out with some guidelines because I'm facing this issue day in and day out in my practice. Alcohol is taken as a normalization today. Alcohol is taken as a part of celebration. And unless we change the mindset of the adults, it's going to be very difficult for us to stop our teenagers. All we can do is stop them up to 18 saying illegal hai, ye hai, it's against the law, drinking and driving underage will cause problems. But the whole society mindset needs to be changed for what we call as responsible drinking or problem drinking, which I wanted to highlight. Yeah, go ahead.
Madam, can I comment? See, one of the child parents asked, "Oh, this is very common in America. People are drinking many times. Why not in our country? Why we are finding whether they are doing a controlled drinking there or here we go haywire? What is the thing?" So I also did not answer because I could not answer to that question.
You know, if you also notice WHO things that when they're talking of NCDs and the 4 behaviors we need to change, risk behavior, they say no to tobacco and no to problematic alcohol drinking. So tobacco is a total no-no, but there's not no-no to alcohol, it's no to problematic alcohol consumption. So this is an area which you really need to work on. And it has become so common that people are taking drinking as normal and part of socialization. It's very interesting that when I told my children that if they want to experiment after the legal age of 18 to 21, they can do it in our house. So when they're 21, I asked, do you want? They said no. So I has to ask them every 3-4 years. And they said, Mom, don't trouble us. When we want, we'll tell you. And my son was in America in the Carnegie Mellon University. And one day he was 25 years old that time. And one night I get a call. 2 o'clock, waking up saying, Mummy, तुम्हारा जो lecture था ना alcohol का फिर से सुनाओ. I said, क्यों बेटा अभी तुमको क्या हो गया? He's saying, no, tomorrow we are going to the San Francisco winery for wine drinking. And we already have a designated driver who's not drinking, who's a Tamil Brahmin, who said he's promised his mother he will never touch alcohol. So he's our drinking. And I wanted your permission now. Can I just try that for this? So tell me all the do's and don'ts. So all the lectures which I was giving him throughout life, he had just stored somewhere. At 25, he asked me, Mom, I want that lecture. So sometimes you feel that the children are ignoring you, they're not bothered, but they still ask you, you know. I mean, he could have just done ahead without asking me, but he felt like asking me and I had to repeat the same lecture. Just sharing my experience.
Any questions are there? Because I think we are running short of the time. Geeta?
Thank you. I think Geeta ji, one comment from my side. Yeah. Actually, just want to share that, one of the students, we wanted to take this up under AHA only. Dr. Geeta Patil, madam.
Research is, you can mention that.
I requested that one is about the young people and alcohol consumption. Like what is their behavior, variations, what are the different concept and profile of this, why this behavior is happening and the consequences, are they aware, and what management strategies also. So this we have sent it to the ICMR, it was selected, for the project was selected. And I would like to do this under HA and give this to 4 other centers also. And I think this will be one of the research under AHA. So this is I think people are interested even as about the alcohol behaviors, what behavior actually patterns are there, and these things, because really the de-addiction centers, lot of centers have opened all over the country in the government only. So there's so much prevalence is there, and even the police department, they have this de-addiction. The bureau is there. So the drug de-addiction. So they are now actually working with the medical colleges also. So there's a lot of awareness on this, around this, especially alcoholism, how to bring it down and what to do. So this is just wanted to share this with all of you.
I think congrats, Hema. Very important topic. And if you can really take it in multi-centers, I think we all will learn a lot because we all need to learn all this and how to deal with it. It's not going to be easy with the present social milieu and the acceptance of alcohol and normalization.
Thank you, madam, for being with us today and especially sharing your wisdom and superb session throughout. We had Dr. Shilpa was really a naughty girl, and Anita and Swati, everybody did so well. And we have our own Geeta Patil with all our, she was with her wise pearls of wisdom and super pearls by Dr. Swati Bhave, madam. It was excellent session. I think kudos to all of you, all the participants. Thank you for staying with us. And Kavita and Prashant, really special kudos to from the Central HA for conducting this program persistently, consistently so well. Thank you. Over to you, Kavita, again.
Yeah, thank you, ma'am. Thank you. Thanks a lot, Swati, ma'am. I would just like to say that alcoholism now not actually a teenage problem, and being alcoholism is not a problem. Not being alcoholic is not a problem. So this is at the society level. If you are not taking, then that is a problem. ये वाला चीज होता है when you go in some party or anywhere. So that we have to deal at the society level, not only at the teens level. So thank you everyone for such captivating and enlightening session. And on this Teachers Day, I would like to say that behind every success story, there's a teacher's dedication behind that. So today I would like to pay my gratitude to all the teachers of the entire series who have, throughout the series, they have worked a lot, right from the session 1 to this session, especially Swati Bhave ma'am to you. So the success of the entire series is just belong to all of you. And the efforts you put by all the experts for this series has been really mind blowing, and has been the role plays, which were the lifeline of this entire series, that were really phenomenal. So thanks to each and every teacher today for making this program a successful and memorable one. And a special gratitude and thanks to Dr. MKC Nayas and Hima Bindu ma'am for taking this program again, because last year when we conducted at CG level, it was really close to my heart. So now you took it at the center level. So thanks a lot to you. And we expect that Sushma madam will definitely take it to another heights. And special thanks to all the audience. Your consistency and your interest is definitely the motivation behind the success of this entire series. So thank you each and everyone, and stay tuned. Next year we are upcoming with some still better version of this.
Actually, why we have another 4 months to go, Dr. Savita, we are planning something more. So just we'll after the National AdultsCon, we'll discuss that.
Yeah.
And I mean, we have, I think I can see Shilpi Golwara there. She's the secretary of the new branch at Patna, Bihar. And so these people are so interested. They really want to join this mission of HA. And there are many people joining every day, members of Central HA. Madam, you all dreamed 25 years back, Dr. Swati Bhave, madam. See, your organization has grown so big.
Yeah. Now you are a fast young adult also.
I know.
Swati ma'am and MKC sir just sowed the seeds.
So they had the vision, and they had the vision. So we are really celebrating, and we want to see all our 25 past chairpersons at Ahmedabad, and to take part in the celebrations. And all of you, all the participants, please do come to National AdultsCon at Ahmedabad. And more there'll be somewhere we all can get involved in some programs, and because we all are now getting the certificate of this course or the workshop named as the counseling workshop, basics and beyond. So after this, Dr. Prashant, who's our digital in charge for this program, will connect with you, and he'll make things clear how your certificate will come. It will be posted in the group. So you will be getting the certificate, and you are now called as counselors of our HA through this workshop. Thank you so much, and I hope you'll utilize your experience and expertise what you've gained for the benefit of the adolescents. You can start Yuva clinics, whether it is in private or public or the government sector. Start seeing patients, adolescent, not patient, they're adolescent clients and parents. Start practicing all the tips what you have learned in all these sessions today. Please do not leave it. If you don't practice, you may forget all the skills. So keep implementing, immediately put in practice what you have learned. So that is my message from Central HA. Thank you one and all once again. Thank you.
Thank you. Thank you. Prashant Karya would like to say anything?
Yeah, Prashant Karya को
प्रशांत जी
बुलाइए.
को भी AHA की तरफ से बहुत बहुत थैंक यू, और डिजिटल सपोर्ट उनका बहुत ही इम्पोर्टेंट
डॉक्टर प्रशांत है क्या?
हाँ, प्रशांत हैं.
He's here.
डॉक्टर प्रशांत.
He was disconnected in between. I think he's
Yes,
fine.
हाँ प्रशांत बोल रहे हैं
To be driving, I think. Prashant is driving, I think. Prashant, are you
एक
driving?
बात
No,
उनका
no, I'm
सुनना
not
चाहिए
driving,
ना।
but there is some network issues.
हाँ
Yeah,
प्रशांत
we want
बोलो
your voice and Prashant as the coordinator of this program.
राइट
So over to you for your, your quick inputs and how you felt this program went on, your message for the
No, thank
participants.
you so much. No more messages. You have all have said everything. But happy Teachers Day to everyone, especially to Swati Bhave ma'am.
Thank you, Prashant.
Yeah, thank you. Thank you, Prashant. Thank you so much. So he's in charge for our all digital thing, and he's such a beautiful counselor himself. And he's very, very tech savvy and helping all of us. Thank you, Prashant, for nicely coordinating this program along with Dr. Kavita. Thank you.
Thank you, everyone. Thank you.
Bye-bye.
Special thanks to Swati Bhave ma'am.
Thank you. Thank you. It was a
Again.
pleasure meeting all of you.
Yeah.
Thank you.
And
madam.
we are so happy that the legacy which we started 25 years ago is being carried forward so beautifully. Each one of you are adults and expert par excellence. And we are very happy to see that.
We all
Thank
learned
you,
it from all of
madam.
you, madam.
Thank
Thank you so much.
you.
Thank you.
Thank you, madam.
Thank
You
you
could
for-
manage, madam. I think I was so confident that you will manage.
Thank you.
Thank you.
Thank you. Thank you, madam. Thank you, Hima
Thank
madam.
you.
Thank you. Thank you, entire
Thank
team.
you, Dr.